before we look at the cost, doctor,
Yes.
let's look at the artificial insemination.
Yes.
Do you use a syringe or you can do surgery? Which method do you use?
So the approaches to the artificial insemination, you know, like any principle of medicine, we try not to complicate things. You go for the simplest but most effective method. Yeah, so we do not do any operation.
Oh, okay.
Yes. In terms of steps of artificial insemination, yes, it's like it is. The basic thing is you're getting the sperms from the donor, preparing the sperms, and then putting the sperms into the woman's womb in the process of artificial insemination. Yes, but before the sperms are put inside there, the woman also has to undergo some medication to improve her eggs. The eggs, at least 2 or more eggs must be released. That increases the chance of conception in this artificial insemination.
Okay.
Yes, that is the baseline for the artificial insemination. Yes. Now, in the donor program, before these sperms are used, they are supposed to be quarantined. This is very, very key. Now, what we mean by quarantine is when the sperms are provided, the sperms are kept either in the clinic, IVF clinic, or they are kept in the sperm bank where those exist.
Okay.
Yes, and they are kept there for about 6 months before they are used.
Okay. For about 6 months?
Yes, before they are used. And the reason is that when you are doing artificial insemination or when you are doing sperm donor program, you don't want any infections to go through the sperm into the woman or to go into the child as well.
So that's why you keep it away for 6 months?
You keep for 6 months. So in this period, you check you check the man, the donor, the person who gave the sperms for any diseases which hadn't sewn up. For example, HIV and all those things. So after they have provided sperm, you follow them up after like 3, 4, 5, and 6 months. And if they are negative, then you can use their sperms.
If they are positive?
If they are positive, you discard.
What if they have STDs? Can it be treated?
They can be treated, but then you will not use their sperms.
Oh, you will not use their sperms?
Yes.
Okay.
Yeah.
Thank you so much, doctor. Let's look at the costs.
Yes, the cost of artificial insemination. Now, artificial insemination is not very costly compared to other methods of fertility treatment, actually. In terms of costs, the average, it ranges between 2.5 to like 5 million.
Okay.
There's some variation a little bit because of sometimes the clinics themselves, the fertility clinics, they do vary in their costs, but also their variation according to the medications you will use for the woman, because she has to undergo some medication, and the choice of the medicine depends on her hormone profile, her age, and other things.
Doctor, before you finish that point, you mean before the whole process takes place, a woman has to go some treatment, tablets?
Yes. So,
so what are those tablets for? To prepare the body, boost the hormones?
Yeah, so I think I need to clarify a bit on the process. I saw an illustration coming up
we can
on
look
the
at the process
of artificial insemination.
Yes.
Yes, exactly. This is it. This is an illustration. So now, naturally, the woman's body is designed to release 1 egg per month.
Only one?
1 egg. In rare occasions, 2. That's how some people get twins.
Twins, okay.
Yes.
Okay.
So, but to increase the chance of artificial insemination, you want more than 1 egg to be released. So we usually target 2 or 3 eggs to be released, so that at least one or two of them can be fertilized. Yeah. So she undergoes what we call ovarian stimulation. Most times, this is a mixture. In our unit, we use both tablets and injections.
Okay.
But in some cases, you end up using injections only. So the woman will undergo these injections or tablets for about 14 days. And in that time, we monitor how her eggs are growing. Okay? So we also want to ensure that she doesn't grow so many eggs. Okay? because you'll get too many babies. You
At
get
the same
6
time,
at the
6,
same
5.
time. Yeah. So if there are too many, we stop the process.
Okay.
Yes. Then when the eggs are ready, we give some medication for her to release the egg, so that the eggs can be picked up by her tubes, and then at that time we do insemination. Now we prepare the sperm. This is what we do. We prepare the sperm so that they are now more active, because we put them inside the womb, but not on the egg. The egg is around here.
Okay.
So the sperm has to be able to swim.
To swim
here.
and go by itself.
Exactly.
Okay.
Now once we've done that, we also give the lady some medication to support the early stages of the development of the pregnancy, what we call the luteus phase support. So it's a whole process. Although the name is insemination, not the whole insemination is not the whole entire time.
It is process by
it's
process.
A process by
Generally,
process.
there are like 5 different
Yes, you have to go
procedures
through
take place.
stages.
Wow, that is very interesting. So
Yeah.
after all these processes
Yes.
and the time, is it guaranteed that the baby will develop? Will it be successful?